Hi guys. Okay, this video is about what to do when state comes. Okay guys, when state comes, I think it really depends on the shift, because state really doesn't come on my shift. They come on the morning shift. So on night shift, what we do during the night is just make sure everything is clean. There's nothing near the computers. There's nothing in the hallways. All of the linen carts and Dynamaps are out of sight. It's just basic housekeeping. Make sure, just housekeeping. Make sure everything is clean. No papers laying around, diapers laying all over the counter, all over the computers where we chart, no drinks and all of that stuff. No papers with patient information, things like that, things we should be doing already, basically. So night shift, we're just kind of like helping the morning shift out, making sure everything is clean or whatever. If they put anything on the counters, if they mess anything up, it's on them. Now, from what I hear from the day shift, they're just like really on their P's and Q's. They're making sure that they're going in isolation rooms, even if they're not doing anything. And they're putting on the protective gear, making sure that the rooms and everything are clean. There's no linen hanging around. They're doing what they're supposed to be doing with the patient, like making sure that the privacy, they're closing the door when they're doing patient care, or pulling the curtains and things like that, things we should be doing anyway. So basically, my experience when state comes, and from what I'm hearing from day shift, they're just checking to make sure you're doing your job. And all of the, heavy stuff is really going to be on management, and the directors and everything like that. So when it comes to CNAs, it's just housekeeping for you, and making sure that when you are going in and out of the rooms, like if you're coming out of the room, you sanitize your hands, you are not coming out of the room with gloves on, things like that. When you are taking linen bags and everything out of the room, that you're not dragging it on the floor. And if it's so heavy that you can't lift it, make sure you are taking the linen cart with you, because we're allowed to do that, and push it, things like that, things that that you are required to do and you should be doing. Now, this is my thing when state comes, because it really gets on my nerves when everybody is all up in a frenzy when state comes, because if everyone was to do their job the way they're supposed to be doing it, when they're supposed to be doing it, when state comes, it wouldn't be, all this hysteria and everyone's going crazy and, when state comes, do this, do that, we gotta do this. It shouldn't be that kind of atmosphere. It shouldn't be that kind of environment. No one should be fearful. It shouldn't, be chaotic. And, people shouldn't be, in fear for their lives and their jobs, because that's what it seems like. Everyone is all up in arms. And it's like, really, people, if we were all to just do our job the way we're supposed to do it at all times, then it would be okay. When state comes, it would just be like, come check us because we're good. We're not going crazy because you're here. It's a regular day. You're here. Great. Check us. We're good. That's how it should be. But because everyone is not doing their job and people are slacking, it's not like that. And it's really on management, because if, for instance, if the Dynamaps and the linen carts are not supposed to be in the hallways, let's forever keep them out of the hallways. You know what I'm saying? Let's just keep them out of the hallways. Keep the Dynamaps in the rooms. If that's what it's supposed to be, let's keep it that way at all times, so that we can all train our brains and train our habits, so that we can do it at all times, so that when state does come, we're doing it without even thinking, So, yeah. When state comes, it's just basically doing your job. That's it. And because a lot of people don't do their job, And because sometimes management doesn't, and the directors don't do their job, making sure that people are doing their job and disciplining people when necessary, when state comes, that's why everybody's all up in the frenzy. Everybody's going crazy. Everyone's all fearful. The atmosphere is all tense. What kind of work environment is that for that day? And we have to think about how is that affecting the patients, our attitudes and things like that. And on that day, everybody wants to be super nice all of a sudden and greet and say hello, when on a normal day, co-workers just walk past each other without saying good morning or hello. It's about a lot of fake and phoniness when state come, and I just, when they come, like, oh gosh, y'all have a good day because I'm out. Night shift. I don't have to deal with this foolishness. But yeah, it's just a lot of unnecessaries. But if you just do what you're supposed to do when you're supposed to do it, when state comes, you would be good. If those people around you are all, hysterical and all up in arms and everything, you just take a breather and you just look at them like they're crazy and you just keep going on with your day, because you're doing your job the way you're supposed to do it and how you're supposed to do it. If management start going all crazy trying to give you a pep talk, just say, okay, yes, thank you, because you already know. Don't go into no explanation. I already do it anyway, blah, blah, blah. Just yes and thank you will cut the whole conversation short. So just do what you have to do and you'll be good. Thanks for asking the question. If you guys have any more questions, you know where to put them, down in the comments section, and I will talk to you guys later. Bye.